Thank you, Dr. Fu. Let's welcome Angie Pierce. She have 25 years in Chinese medicine and internal arts. 这是个internal arts for the 25 years, including Tai Chi and Qigong for the over 25 years. And enjoy being acupuncture and herbalist for 12 years and working in the Chinese pharmacy and in internal part of the team for 9 years. He teaching currently in the first year at the Chinese Herbal Program at Colorado Chinese Medicine University, and involved many occupational contribution. She assisted with the supervision student clinic a few times a month and help with a herbal assessment team to ensure the student understanding the breath, that's a TCM field. She has her own practice where she say her specialty is a people, and also currently working on her doctorate degree in University of TCM at Colorado. Let's welcome Angie Pierce.
你好, or hello. My name is Angie, and today I'm going to be talking to you a little bit about Chinese herbal medicine use in the prevention of type 1 diabetes mellitus. When we talk about this, we really have to discuss the two different types of diabetes first. So in the Western medicine world, we have type 2 diabetes, which is a metabolic disorder. It is diagnosed most often after age 45. Their pancreas makes less insulin, still makes it, but it doesn't make as much. And their body also doesn't absorb it as well. So this is part of why it is a metabolic disorder. There is a genetic component to it. It tends to run in families, and the mortality rate decreases the later in life that type 2 diagnosis is. So if they are diagnosed at, say, age 45, that mortality rate is higher than someone who was diagnosed at, say, age 60. Versus type 1 diabetes, it's an autoimmune disorder. That means their body has to make 4 different anti-insulin antibodies to tell their body not to make it, and then they become type 1. So this is often diagnosed prior to age 40. Most times people think it's still called childhood onset diabetes. I myself am type 1 diabetic. I was diagnosed at the age of 7. And so if you were diagnosed under 18, you were childhood onset. But if you were diagnosed in your 20s, you were type 2, even if you took insulin. The last couple decades of research have shown that people are being diagnosed with the autoimmune type of diabetes well into their 30s because they are showing all 4 antibodies. So this is new in the last couple decades. In a type 1, their pancreas quits making insulin. The pancreas has 2 functions. It's an exocrine gland and an endocrine gland. Your endocrine glands make your hormones. Insulin's a hormone. So when the pancreas quits making insulin, what is called the beta cells quit working. But the exocrine part keeps working, and it still dumps the pancreas into the tummy, helps the body digest its food like it's supposed to. So only part of it quit working. The antibodies are very specific. What do we not want to have work, right? So in a type 1, that mortality rate runs anywhere from 3 to 18% higher than non-diabetics. And it has such a wide variance in range because people lose their lives based on different reasons because of their type 1 diabetes. With type 2 diabetes, again, this is the most common type. When someone says, oh, my grandma's diabetic, probably, not definitely, but probably type 2. 90 to 95% of your diabetic population is a type 2 diabetic. They may require oral medication, diet changes, increase in exercise. Sometimes they also take insulin, but they also take other injectable medications. And often these are used to help their bodies absorb that insulin a little better and help them just better function in that metabolic component of the insulin. With a type 1, that's only 5 to 10% of the diabetic population. And so when we're looking at, hey, are you type 1 or type 2? Again, probably type 2, but you will run into us type 1s occasionally. We require daily insulin. But of course, anybody, including us, benefits from diet changes and increased exercise. So with type 2 and type 1, even though they're different diseases, they definitely have very similar and mostly the same possible long-term effects. So some of these include neuropathy, and this is like loss of feeling. This can happen in the hands, the feet, or the sexual organs, not just erectile dysfunction in men, but women also develop clitoral desensitization just like men can with their erectile dysfunction. They can have retinopathy. This is a vascularization of the vessels in the back of the eye that can sometimes cover the optic nerve, where that person would then lose their sight, or it becomes so prevalent in the eye that they can't see through all the broken blood vessels and the new growth back there. And when they laser that to fix that, then you lose the outer periphery of the eye. So they can lose their actual sight or lose just the periphery of their eye, depending on the progression of their retinopathy. Nephropathy, that is related to the kidneys. And so when the kidneys start to not work as well as they should, one of the first signs that this is happening is an increase in blood pressure. So even if your blood pressure were normal, when those kidneys aren't working as well, your blood pressure goes up. Also with nephropathy, then we can have organ failure, which can then lead to, of course, a need for an organ transplant. Type 1 diabetics also have early loss of bone density. This is a new study that's coming out trying to pinpoint when exactly that happens in a diabetic's world, but there is an early loss of bone density as well, and also an increased risk of heart attack and stroke. This is a very common and the number one reason diabetics lose their lives is from heart attacks and strokes. There are more possible effects of either type. This isn't always the case with every single person who has both or either type 1 or type 2, but some of those consist of a compromised immune system. I've heard this my whole life. You have a compromised immune system. And, you know, for those of us who have autoimmune disorders, that always sounds weird because my immune system's in hyperdrive, compromised from normal level, but mine works better than it should. It actually goes, oh, what is this? We need to make something and not make a part of your body work. Autoimmune disorders are strange when it comes to that immune system. Glycated tissue. Glycated tissue is when the tissue becomes thicker. It becomes thicker because the blood sugars run a little bit higher. When the blood is thicker and the blood sugar is higher, it makes the tissue that it's running through very dense and thick. And so that glycated tissue happens anywhere blood runs. So this can be in just your muscles, but your heart, and your heart is a smooth muscle. And so that gets glycated. When it's dense and thick tissue, it can't pump as easily. And when that happens, then those heart attacks can happen. So glycated tissue is definitely something that can contribute to that heart attack and stroke increase. Diabetics also have dry mucous membranes, skin and hair. If you've ever put sugar on a bowl of strawberries and it sucks all the moisture out of them, that's exactly the same thing that happens in a diabetic, type 1 or type 2. Again, blood sugars run a little bit higher, things get dried out. Again, your nose, your eyes, your mouth, your skin, and your hair. And as you will hear on many TV commercials, diabetics and their slow wound healing. So diabetics do tend to have slower wound healing. The blood does not circulate the same way if the blood sugars are higher. That slow wound healing can also lead to infections that are not healing, and those infections can then lead to amputation. So when we get to Chinese medicine and we get to look at what we are doing with this disease that we call diabetes in Western medicine, we call it xiaoke in Chinese medicine, and either type 1 or type 2. Xiaoke means wasting and thirsting disorder. And so when I'm looking at a diabetic in my office, I'm looking at where did it come from? What are our primary reasons we have it? So we divide it into what we call the upper jiao, the middle jiao, and the lower jiao. And the upper jiao consists of lung and heart and pericardium, middle jiao, stomach and spleen. Some people say liver and gallbladder. And the lower jiao would be all the rest, your large intestine, small intestine, bladder, and your kidneys. And then, of course, some people say liver and gallbladder. So in your upper jiao, we have 2 different diagnoses we would call that by. Lung yin deficiency. I use the word shu because shu means deficiency, or lung heat. In our middle jiao, we have stomach yin deficiency, shu, or stomach heat. And then in our lower jiao, we have kidney yin deficiency, but also just general qi and yin deficiency. Okay, so these are our 3 jiaos and our 6 different stereotypical diagnostics that we would use for that. When I look at the symptoms of xiaoke by the jiao, upper, middle, or lower, that we are looking at, when we look at the upper jiao, that first primary symptom is excessive thirst. The middle jiao, its primary symptom is excessive hunger. And in the lower jiao, that primary symptom is excessive urination. So if we look at when people are diagnosed, one of the first symptoms or signs across the board, increased thirst, increased urination, and weight loss. So in Chinese medicine, they are almost identical, except that excessive hunger instead of weight loss. What happens with that weight loss is the blood sugars are higher and the system can't function with using the sugar that's coming in for energy. So it comes in one end, goes out the other, and you don't absorb any of the food. And that's where the weight loss comes from. When that happens, your body has excessive hunger. You're ravenous. You can't get anything in you to satiate you because you're not absorbing that food. So these are symptoms before treatment, right? These are things that would alert someone that, maybe we should check to see what's going on there. Other symptoms that can happen, a dry cough, constipation, undigested food in the bowels, feelings of heat, irritability, exhaustion. That irritability, when your blood sugar is high, your blood is thicker, it's not moving as fast, you get headaches, you get cramps in your muscles, you don't feel good, right? Again, cramping muscles, headaches, chest pain, but also blurry vision and floaters. These are other symptoms that can happen when things haven't been treated. We have a number of formulas that we can use, and I'm not going to read through these for everyone, but with our upper jiao, we have very specific formulas that very specifically for that lung, Lu represents lung, yin deficiency or shu, right? Many of these, really, those formulas, they treat the yin. They help nourish what we call moisture in the body. The yin is our vital fluids that we need. And so when that is deficient, we need to replace that. We also have lung heat. So these formulas here listed help to decrease the heat in the lungs to help them better be able to function. When I look at my middle jiao, the stomach yin shu, that deficiency, again, it's a lack of fluid, vital fluids that are in the stomach. Without those vital fluids, we can't process our food. We can't digest it properly. That is why the symptoms from the previous slide, like undigested food in the bowels, that is something that can happen. Also with stomach heat. Stomach heat makes us ravenous. It makes us super hungry, that excessive hunger. We try to clear that heat. We don't want to make it cold. The body's supposed to be warm. That stomach is a cauldron that helps ripen and rotten that food for digestion. In our lower jiao, again, we're working with that kidney yin deficiency. Ki is kidney. And these formulas all help nourish that vital essence fluid, right? That vital fluids of the kidneys to help rebalance the system, to decrease those symptoms of xiaoke. So then those are the herbal remedies, but then we get to the acupuncture remedies. So for our upper jiao, we have different points. We treat yin deficiency and heat in the lung differently. We have for yin deficiency, these points, LU is lung, SP is spleen, UB is urinary bladder, and KI is kidney. These points are located along the channels, and different points do different things. That's a whole other presentation on itself. But these are simple remedies used. Do these cure it and fix it overnight? Absolutely not. But these are a good way to help start looking at, well, what are things that help rebalance? For instance, the stomach yin, right? What points are we looking at? That SP6, spleen 6, that's a very yin nourishing point in the body. So that's one of those ways that we can help rebalance those vital fluids that are missing in yin deficiency. Again, upper, middle, and lower jiao, they all have their points. Some of them have very similar points, and they use the same ones. Kidney yin deficiency also uses spleen 6, right? Spleen 6 is about yin. So it gets used quite a bit. There's lots of research out there, right? We have different research related to different herbal medicines being used to work on the metabolic control. Some of them are working to decrease blood sugars and make sure that the blood sugars are staying lower. Any of these things that we are looking at with herbal medicine to do that is about treating what's already there. They've been diagnosed. We're giving them these herbs. We're trying to figure out, can we lower the blood sugar with this? Can we increase insulin absorption with this? This team of Liu, Zhang, Wang, and Grimsgaard, they did a study with the Chinese formulas, different ones, and found that there were 7 herbal medicines that had help them have better metabolic control than without. They found 15 different herbal preparations that showed other benefits to drug therapy that helped keep blood sugars low. And then they found 2 different herbal therapies that when they mixed those with diet and behavior changes showed better hypoglycemic effects than just diet and behavior changes alone. And that's pretty cool, right? So this other team, led by Leon F., they did a double-blind study over 12 months. They did the Chinese herbal medicine called Tianqi capsules or a placebo. And they did this between 2 different groups. They showed that the placebo group had a higher percentage of people with glucose intolerance at the end of the study than those that were taking the formula. But they also showed that there was around a 32% decreased risk of diabetes as compared to the group that wasn't taking it. So that's kind of cool. It's like, you don't have it, and we're going to give you this, but now you have less risk. So there was something about the Tianqi capsules that absolutely helped. It's like 1/3, right? Decrease their risk of diabetes by 1/3, and that is awesome. Another team studied one of our herbs that we call shanya, which is Chinese yam. That Chinese yam is used in food therapy as well as herbal therapy, but they were able to show that when they used it with the Western medicines, so like the oral medications or the insulin, they were able to lower blood glucose levels, also their cholesterol levels. They decreased their insulin resistance. That was kind of amazing to find out from this one food that you can help add to the system and add into the diets, that it really can help control more than just that one thing, right? So then this other study I looked at, which I really liked, they followed these participants over the course of 6 years, and they were studying their glucose serum levels right after eating. And then after that, they would give them a glucose tolerance test. And what that means is they make them drink this stuff with all this glucose in it. They let it sit in the system a while, then they check the blood sugar, like, did it go up? Did it go way up? Or did it just stay kind of normal where it's supposed to? Any of those who tested positive, right, with that glucose tolerance test were then given either a diet-only intervention, an exercise-only intervention, or a diet plus exercise intervention. And then there was also the control group. So the diet-only group, which was great, they were divided into 2 separate groups. If they were, their BMI, their body mass index was over 25, or if their body mass index was less than 25. So they were given different percentages of carbohydrates, proteins, and fats. And all groups were encouraged to increase their intake of vegetables, because everybody needs vegetables. The exercise-only group was also divided into 2 groups. But they were divided based on age. So there was over the age of 50 or under the age of 50. And then they were each prescribed different units of exercise per day, depending on what group they were in. And then your diet plus exercise group were given a combination of both of those 2 different groupings of the diet or the exercise. So they had both. And then the control group was only given information on diabetes and impaired glucose tolerance, but absolutely no formal instruction. Now, what I found interesting was that, so after 6 years, those receiving intervention, like the diet or the exercise or the combined, they showed between 25 to 50% less incidence of having diagnoses of diabetes than that of the control group. And that is spectacular, right? That is spectacular. Again, this is with exercise, diet, or a combination of the 2. And then we have a study which actually talks about the prevention of type 1 diabetes, which is really what kind of my goal in my career is, to help show that maybe we can use some Chinese medicine for this. This isn't based on Chinese medicine, this research, but this research was about decreasing the possible diagnosis of type 1 in children who were identified as having a higher risk factor. So this study looked at early exposure to complex dietary proteins. They were thinking that the beta cell autoimmunity part that happens with the no production of insulin, they wanted to show that removing that dairy protein actually would help them not be diagnosed diabetic. So they did this randomized double-blind clinical trial. They had over 2,000 infants in 15 different countries. They were either given what's called a casein hydrolysate or a conventional cow's milk formula, supplemented with 20% of the casein hydrolysate. They tested for 2 or more islet autoantibodies to compare the 2 groups. And this was done with the cord blood at birth. And then they took blood samples at 3 months, 6 months, 9 months, and 12 months. They then annually continued to do that up to the age of 10. And post age of 10, though, they were followed for another 7 years. The findings, unfortunately, did not show that there was any difference between the 2. It didn't show that it provided more protection to take the dairy out. So the test, which has run for about 20 years, came up inconclusive, but it was a good place to start for, can we identify this? Can we do anything about that? So that was some research done on prevention of type 1, very specifically with removal of cow's dairy. So I do have one case study related to prevention. My niece, she was 6 years old. Her family has a history of type 1, father, maternal aunt, me, and her maternal grandfather, my dad. She had the presence of one autoimmune antibody through another study for children who were identified as having genetic predispositions for diabetes mellitus type 1. I started Chinese herbal intervention 8 months after that first positive insulin autoantibody, which will be referred to as IAA. Her formulas were implemented based on Chinese diagnostic tools, so her pulse and her tongue, and then other symptoms that she was showing or blood tests, things like her low iron that showed up throughout this testing. Her antibodies, once they tested positive, were checked every 3 months. Over the course of 6 years, she let me work with her. The antibodies remained positive. However, they did decrease in level. Compliance with herbal intervention was not always fully followed. Periodic acupuncture treatments were also implemented, but primary focus was on the herbal intervention. I did use some primary formulas. I used Xiao Chai Hu Tong, Liu Wei Di Hong Wan, and Si Jun Zitong, and Xiao Yao San and Gui Pi Tong. So those 5 formulas were very instrumental in the formulas that she took, and it was sometimes a combination of them and sometimes individual ones of these. Compliance with the herbs showed changes in the IAA levels, and changes in her hormones showed increases in the IAA levels. So when she hit puberty, those IAA levels increased and then came back down. Home environment changes showed elevation in IAA levels. Her parents got divorced during this time, and at that time, those IAA levels went right back up to where they were. So her IAA levels followed for 7 years. And then her common root diagnosis in Chinese medicine was damp impeding the normal flow of sanjiao with one of the following: sometimes kidney yin deficiency, sometimes spleen qi deficiency, liver blood deficiency, or heart blood deficiency. Here's a chart showing at the very beginning at the top, there were no herbs. There were no herbs for those first 3 readings. And then we started bringing in the herbs, and you can see them drop down. Now they still stayed positive. And when you're testing for antibodies, that's all they want to know. Is it positive or not? So it was positive, but those levels decreased, and it showed enough promise to me that I was like, I want to do this. Some of these issues, there were other variables like illnesses that happened that were not considered in my findings. And there's been no follow-up from me in the last 2 years. However, her readings are still negative for diabetes type 1 at present. So that's some pretty promising work, I think, that was shown with this case study. So my conclusion, there are many studies on blood glucose control in diabetics of both type 1 or type 2 with Chinese herbal medicine. Type 2 diabetes has research regarding prevention of diagnosis with such interventions as diet, exercise, herbal medicines, and weight loss. And the studies regarding prevention of diabetes are followed for many years to gather information regarding long-term effects of interventions. Research surrounding the prevention of diabetes type 1 is very limited. There's some long-term studies that have all shown inconclusive evidence. And again, there's none on Chinese herbal medicine and prevention of type 1. There are studies with Chinese herbal medicine and prevention of type 2. They have shown some promising results in increased insulin absorption and glucose control. That is awesome. We want to keep that kind of stuff going as well. But again, very scarce literature is available on prevention of diabetes type 1 with Chinese herbal medicine, and there's a great need for more research on this. And then my references. So, 谢谢, thank you, and I hope you enjoy the rest of the conference.
Thank you for Angie. This is a wonderful presentation. The diabetes is very common lifestyle medicine disease in the world, and people always confuse type 1, type 2 diabetes, and by using Chinese medicine can successful and significant control and prevent type 1 diabetes. This is milestone presentation. And also give, again, I really appreciate that give people's hope for the people who have a type 1 diabetes, for their hope to using Chinese herbal medicine as one of the tools for prevention the type 1 diabetes and for the better quality of the life. Thank you again, Angie. This is a wonderful presentation. I'm looking forward to your success. And thank you for the servings in the community, for serving for the people who are suffering the diabetes. Thank you. Thank you very much.
So thank you, Angie Pierce. You are very interesting with the Chinese medicine and the Qigong and Tai Chi. We can see your passion. It's a really help with other people, especially with you researched with the diabetes, and you help a lot of the students study better, and also you keep doing Tai Chi and Qigong, keep your health, and help more people interested for the Oriental medicine and the East the arts. So thank you, the Dr. Angela Pierce. So thank you, 谢谢。